thank you for taking the time. Please state your name, your age, the type of cancer you're dealing with, and when was it diagnosed?
Okay, so my name is Daniela Tendler. I'm 24 years old and I'm from Israel. I have low-grade ChondroSarcoma in the pelvic, in the left pelvic. It was first diagnosed in 2008, 5.5 years ago.
And could you tell us, 5.5 years is a long time. Please tell us your journey in 2 minutes.
Okay, so it was discovered when I was 19. I had pains in my leg, in my upper hip, every time I used to sit or lay down. Then after a while I took an x-ray and they discovered the tumor, and after an MRI they kind of knew that it was malignant. So they offered to take it out. So I did the first surgery in Ichilov Hospital in Tel Aviv, Israel. It was in 2008. It was taken out with the free margins, and the pathology, it said low-grade ChondroSarcoma. And they didn't expect it to come back. They told me probably that now I'll be healthy. But after 2 years, I felt the same pains again in my leg. And after an MRI, they saw that the tumor came back. So I did another surgery, the same kind of surgery. This time they weren't able to take a free margin the way they wanted to. And they told me it will probably come back. But there was nothing else they could do. They didn't know about other treatments that could help me. So indeed it came back like 6 months after that. And then all this time I was treated still in Ichilov Hospital. And then they told me that surgery wouldn't be enough. So they offered to do a surgery and radiation, but a special kind of radiation, proton therapy. They didn't know if it would work, but they said that we should try because we don't have other options. So we did do the surgery. Again, the same kind of surgery, just to take it out. And then I flew to Oklahoma City and I took there the treatment, the proton therapy. I've been there for 3 months. This proton therapy is a special kind of radiation. It's very precise. It's not, it doesn't go to all of the area, just where the tumor is. And actually, in my case, now after almost 2 years after the last radiation, it seems that it did work. All the area that was radiated is now stable and nothing grew there. But unfortunately, during the last surgery, some cells from the tumor got spread to the other side of the pelvic and to the upper side of the pelvic. And then it came back there. So I had to do another surgery to take this tumor out. And then they offered to do, again, the radiation therapy, but in the new area, in the area that it grew. So now I'm in New Jersey, in Procure, and doing the radiation therapy over there. They're pretty positive that they will be able to clear this area that they're radiating. But again, I still have the risk that in the last surgery, some other muscles got spread again.
Please tell us about the first signs and how long was from first signs to diagnosis?
Okay, it started with the pain in my upper hip. I complained about it and went to a few doctors, and they thought it was like inflammation in the muscles. So I received pills, and it was, I guess, something like 3 months until somebody sent me to take an X-ray. And then when in the X-ray they saw that I had a bone tumor. It was multiple exostosis. It's not malignant, so they thought it was okay, and they sent me to take an MRI. And in the MRI, they saw the ChondroSarcoma upon the multiple exostosis. And then we went to the oncologist and the orthopedics, and it was, I guess, maybe 3 or 4, at least 4 months after I started feeling the pain in my upper hip. And even when they saw the MRI, they wasn't sure it was malignant, but they did suspect it. So they wanted to take it out anyway, and then to see in the pathology what was it. It wasn't an easy diagnosis. The first doctor that we saw, he was sure it was malignant and thought it was ChondroSarcoma. But then we went to other doctors, and they wasn't sure it was malignant. Even the doctor that treats us until today, that is the best he's supposed to be the best in Israel in this field, he wasn't sure at all that it was malignant, but he knew it had to be taken out anyway. So we did the surgery, and then the pathology said it was ChondroSarcoma, but they wasn't sure before. By the MRI, they couldn't tell.
So the knowledge that it's ChondroSarcoma was only after.
Yeah, definitely.
Okay. And you mentioned it was taken out. It was taken out with clean margins, right?
Yes, the first pathology said free margins, clean margins. Yeah, definitely. And they were pretty confident that it wouldn't come back. They were confident.
And that was true for 2 years?
For almost 2 years, until I started feeling the pain again. They didn't even let me do another MRI test. I just started feeling the pain again in my upper hip. So they were really confident that it would stay stable, but it didn't.
Okay. And after 2 years, you had your first relapse.
Yeah.
And you started feeling pain again in the same place.
The same pain again. I recognized this pain. It wasn't something, I was sure it was that.
And then you went back to your doctors
and did another CT scan, an MRI scan, and then they did a biopsy, a needle biopsy, because they wanted to make sure what it was before we do another surgery. So we did a needle biopsy, and it did say the same tumor, low-grade ChondroSarcoma.
So, and then the recommendation was to have another surgery?
They didn't know of any other treatment. They knew for ChondroSarcoma by the book, you only take it by treat it with surgery. They didn't know of any other option, but they did knew to tell us that if it came back once, then there are chances, a bigger chances that it will come back again. They did say that.
Okay, so the treatment then was a surgery. Okay. Did you manage to take it out with clean borders?
No, the second surgery, they weren't able to take care of margins.
Okay, so then what?
So then they prepared us. They said there is a possibility that it will come back again, and if it comes back again, then surgery wouldn't be enough. We'll have to think of something else. And they told us that there are no treatments like by the book for ChondroSarcoma, so they'll have to be creative, they'll have to try something, they'll have to think about it. They didn't know what to do.
So this is 3 years ago?
Yeah, I guess.
So there was no protocol?
Nothing else but other than surgery, nothing else.
Okay, so the treatment was a surgery, you had no clean borders,
no.
And there was nothing else to do?
No, they just wanted to wait and see what happens.
And what happened?
It relapsed, it came back.
After how long?
not more than 6 months, I guess, that they first saw it, and then they took some time to think about it.
In the same place?
In the same place, exactly. And then they came up with 2 options. The first one is a very large and extensive surgery. And the second one was to take a regular surgery, like with no big margins, and to do the proton therapy afterwards. And then we consulted with other doctors. We consulted with Dr. Ben Arush in Rambam Hospital in Haifa in Israel. And she didn't know a lot about it as well. She investigated some, and she at the end she did suggested, she saw that the proton therapy would be better because it would be better for me, because a big surgery is something that would be very difficult to live with afterwards, and proton therapy would be more delicate with me. And then we also went to the Rabbi Fira with this, and he told us that the best place in the world to ask this question is Mayo Clinic in the United States. And we did approach them. We sent them my footage, my photos, all of the MRIs. And they went only conservative. They said proton therapy wouldn't work, and they offered me to do a very, very, very extensive surgery, including amputating the leg. We didn't want to go with this option. Then there was a time that we went to see a lot of doctors and hear their opinion. And they really let us down, because none of them really knew what to tell us, knew what to do. They didn't have like a firm answer that this would help you or this would help you. And in this time we also tried some alternative therapies, but unfortunately it didn't help, and the tumor kept growing.
Such as what? What did you try?
Something naturopathic, and like with plants and herbs, but it didn't help, unfortunately. So we had to take a decision. It was hard because it was like a gamble, because we didn't know what to do and nobody promised us anything. But the proton therapy did seem much better for me, for my health. So we went for the smaller surgery and the proton therapy in Oklahoma City afterwards.
Would you say that it would be right to assume that all these different non-conclusive opinions that you got were because ChondroSarcoma is so rare that very few people know about it, there is not much track record, and there is no protocol?
Exactly, that's exactly the reason. There is no protocol. Nobody knows if this medication would help or if this would help, because they don't have the experience, and the proton therapy is pretty new in the field. And in the books for ChondroSarcoma, it's only surgery, and in my case it obviously didn't help, so they didn't know what to do because there was no protocol if surgery doesn't help.
You mentioned a significant surgery versus a smaller surgery in proton therapy, which is radiation therapy. What's the significant surgery? What was it about?
Okay, the significant surgery was about taking margin as much as possible. And they spoke about taking out my bladder altogether, amputating the leg, the ovaries, the uterus, like lots of the organs in the pelvic. And obviously, when we heard about it, we said no.
If it's a cancer in the bone or the stuff within the bone, the chondro, what's the point in taking out?
It's not in the bone. It's soft tissue cancer. It's not in. It's like it grows like an island. In the beginning, it started from the bone tumor, but afterwards, all of the relapses, it grew by itself. The ChondroSarcoma, not connected to any kind of bone.
It's a part of the chondro, schus.
Exactly. it's a cartilage.
Yeah. So what's the point in taking out internal organs?
Margins, free margins. That's the point. It wasn't attached to any organ. It didn't went through any organs. It just touched all of them, and the point was taking them all out in case they were contaminated with the tumor cells.
Okay, so you decided to go for a smaller surgery, leave yourself intact, and do radiation. So where did you did you have the surgery, and what's next?
Okay, all of my surgery I had in Ichilov Hospital in Tel Aviv. The radiation, first of all, we heard about it from Dr. Tuchner, and he's from Philadelphia Hospital. He has a proton therapy center over there. We spoke to him, and he didn't convince us to go with him. And also, it was expensive for the Israeli insurance. So the Israeli insurance sent me to Oklahoma City. And then we started to investigate the doctors that is the most experienced in the proton therapy field. And then we read about Dr. Hug. He's the one who has treated me in Oklahoma City, and he is treating me now in New Jersey. And then it worked out for the insurance as well, and for us, we read that he had a lot of experience. We spoke to him, he convinced us, and we liked him, and there was chemistry, and we went for Oklahoma City.
Okay, so after the surgery in Ichilov, you went for radiation therapy in
exactly. We waited
City?
1 month for me to heal from the surgery, and then.
And how many cycles? How was the radiation?
It was. I don't remember how many treatments, but I was in Oklahoma City for almost 3 months for this treatment. It was a very delicate treatment. I had some side effects, but nothing serious. I felt good, and we were very satisfied with the treatment that I got there.
And by the end of it, so when you went, so first of all, okay. During the surgery, were they able to take clean margins?
No. At the third surgery, they didn't take free margins, and they left some tumor pieces that they couldn't reach. But they said it's okay because the radiation will treat it. They will be able to treat it with radiation. So not only that they didn't take free margin, they also left a couple of pieces of the tumor.
And after the radiation, was there any change in the MRI or PET-CT?
After the radiation, they only expected to see that there is no change. They didn't expect the tumor to get smaller or something like that. They just wanted it to stay stable, all of the area that was radiated. And actually that was the case. Even now, almost 2 years after I did the treatment in Oklahoma, all the area that was treated, that got the radiation, is stable. The tumors, they stay exactly the same size. They even get smaller with time. So it seems like it did work, because you can't really test it. Only with time you can see if it worked or didn't work. This radiation, this proton therapy is a very special kind of radiation. That it's very precise. The radiation goes only where it's supposed to, only where the tumor is, only where the tumor was, and this radiation, it really treated the bed of the tumor, the place where the tumor always grew from. Each time it came back, the tumor grew from the same point, so it took care of that, and now it's clear.
So radiation therapy, as opposed to other therapies, that regular therapy is in an area, and radiation therapy is exactly to one point and it doesn't go further.
Exactly.
And the advantage of that is that you don't radiate other organs.
And in ChondroSarcoma, there's another advantage, because on ChondroSarcoma, radiation, it doesn't affect ChondroSarcoma. At least that's what they said. But in this special therapy, they could radiate in very, very, very high dose on the tumor because they don't affect any of the other organ. The tumor can receive a much higher dose, and then it does affect the ChondroSarcoma.
Okay. So you had a radiation, and there were still tumors there, but over time, doctors were able to see that the tumors don't grow; they may even shrink. So
Exactly.
it may be dead tissue.
Exactly.
Okay. So that was your third surgery and radiation.
Yes.
How long did that hold, and what happened next?
Okay, so really like 6 months after I was done with the radiation, I did my periodic MRI, and then they saw there are new tumors. But after they investigated it, they saw that this tumor, they grew outside of the area that was radiated. I mean, this area that the tumor grew in didn't accept any radiation. So they assumed that this tumor grew due to some kind of contamination that happened during the last surgery. During the surgery, some of the tumor cells got spread to the other side of the pelvic and to the upper side of the pelvic. And when I went to their proton therapy, they didn't know it was spread, and they only radiated the area that the tumor was there. So they didn't know they should treat it, and after 6 months they saw these new tumors. And then so they didn't know exactly what to do. Again, they gave me 2 options. The first option was to do it all again, to take it out by surgery and do another proton therapy. Because this area wasn't radiated, they were able to do the radiation again. But they offered me another option, an experimental treatment of chemical treatment and biological treatment.
Chemotherapy.
A chemotherapy and a biological medicine. And they said they did a clinical trial. These 2 medicines, the chemical one is cyclophosphamide, and the biological one is rampamune. And they said they did a clinical trial in Ichilov Hospital on 10 people, and like 50% of them, it helped, it affected, either it stopped or I don't know. So they recommended me to try this, and we thought about it, and we accepted their offer, and we did try this treatment for almost 5 months. And after 5 months, we saw in the MRI that the new tumors kept growing. So we went for the original plan to do another surgery, and now I'm here taking a proton therapy again.
Okay, so during the surgery, the last surgery on the new area,
Yes.
were they able to take clean margins?
After the last surgery, the pathology said marginal tumor. It means that they were able to take margins, but not exactly as they wished. And actually, when we did an MRI after the surgery, we saw that they didn't even take the whole tumor out. They didn't reach a certain point, and they left a piece of the tumor over there. But Dr. Hook, the one that is treated me with proton therapy, says that he can radiate this tumor, that it seems okay.
So you are now actually you are now in the midst of proton therapy at Procure in New Jersey.
Exactly.
Under Dr. Hoog, which is the same doctor who did the radiation therapy back in Oklahoma.
Exactly.
And how far are you in the?
I'm halfway through.
Halfway through. How many cycles?
34.
34 radiation cycles.
Mm-hmm.
And what's the expectation?
The expectation is that they will be able to treat all this area that the tumor was there, that this area would be clean. It wouldn't. It would stop the tumor over there. But their biggest concern is that the same thing happened in the last surgery, that cells got spread again and maybe got to the area that was radiated the last time, and then they can't radiate this area twice. So that's their biggest concern. My doctor is pretty sure that he can treat this area and that it will stay stable, but he can't promise me anything about the rest of the pelvic and the stomach.
So to summarize, you had the first cancer, then after 2 years you had one relapse, and then after 6 months you had another relapse with no clean borders, and then you had another relapse, which you did also the chemo, the radiation in Oklahoma, and that was done for that side. Okay.
Exactly.
And then you had a new appearance on
the other side,
which you are now dealing with.
Exactly. And then I tried the chemotherapy, and then they did a surgery, and now I'm having a proton therapy again.
So because ChondroSarcoma is very rare, and it's even more rare in young patients such as you, so you are now a world master in ChondroSarcoma. So for the parents who are now watching this video, first of all, information. Where do you think parents can get the most relevant and updated information on the website?
On the website?
On the internet.
I guess they should go to at least Google Scholar or PubMed, and something that would have more base, because in the internet, when they speak about it, they only speak about surgeries. They don't talk about the more rare cases in which surgeries don't help, or that there is not a possibility to do surgeries. So in that case, internet wouldn't help so much. You should go to a more certificate articles such as PubMed and Google Scholar at least.
Google Scholar is free?
No, not all of most of the article, no.
Most of the people out there, they don't have access to PubMed because it's for medical staff, right?
Exactly, that's the problem.
Okay, so there is not much information on the web. Where else can Facebook maybe?
Not that I know of.
Do you know of any forum that someone can reach out to a ChondroSarcoma patient?
Unfortunately, no.
Okay. The fact that you are a very young patient, how does this make the treatment in you different than an older patient?
Maybe in younger people, they pay more attention to the quality of life and they think further. Maybe they wouldn't want to do surgery every 2 years because it's just not a way to live, or amputating the leg when there are other options that they could think about. So I think that's the main difference. And also, when we spoke to the doctors and they didn't know what to do, it appears that I was the first one in Israel that got treated in proton therapy for ChondroSarcoma. There were a lot of cases of ChondroSarcoma, but in older people, and maybe they didn't think that much of other options because surgery was a good enough option. So in my case, I was the first one that was treated with proton therapy for ChondroSarcoma in Israel.
Well, that was around 2010. Are you aware of any differences in the treatment in Israel versus in the US or other places?
There are many differences because we hear lots of opinions. In Israel, my doctor says that there isn't a clear protocol for my situation. In the United States, we spoke to several doctors. In Mayo Clinic, for instance, they are very conservative. They said only surgery is the treatment, only large and extensive surgery is the treatment, and nothing else works, not radiation, not chemotherapy, it's useless. And we talked to another doctor, Dr. Tuchner, that treats in Philadelphia, and he said that in the United States, the standard of care in ChondroSarcoma patients is proton therapy, a surgery and then a proton therapy. So we're pretty confused. I don't know what's true, but my doctor, Dr. Hug, he says that he has lots of experience with ChondroSarcoma patients in proton therapy, and the successful ones. He says that he did treat for many years ChondroSarcoma patient and that he succeeded.
You know that there is a very unique situation with ChondroSarcoma, that because you don't treat it with chemotherapy, usually an oncologist would be your main doctor. But
That's
with
right.
ChondroSarcoma, it's not the case.
That's
it's
right.
either your surgeon
or
or now your doctor, your caregiver is a therapy.
radiation, yeah.
Right.
So my doctor in Israel is an orthopedics oncologist, but at some point they did transfer me to the oncology department when they saw they couldn't help me with surgeries. But after the chemo didn't work, so they sent me back to the orthopedic oncology because they understand that the oncologist couldn't help me. So it is complicated.
Could you mention the best places, medical centers, hospitals, doctors that a parent should contact?
In Israel, the biggest center for this kind of tumors is Ichilov Medical Center. In the world, I know that in the United States, Mayo Clinic is the best place, the most experienced place with ChondroSarcoma. But again, in my case, they couldn't help me, or I didn't like the way of treatment, their way of treatment.
So maybe Dr. Hug would be a good person to.
Exactly. Exactly. If you're going through proton therapy, if you're considering proton therapy, Dr. Hug is an excellent doctor, and I can only recommend of him. He's very experienced and a very pleasant person.
If you could go back 2 years, or because 5 years, the treatments were. The treatments of today were unavailable 5 years ago. If you could go back 2 years, what would you have done differently, if at all?
Maybe I would pick the best place to take a surgery, because it's very, very significant in ChondroSarcoma that the surgery would be as clean and precise as possible. And then I would go to take the proton therapy, because the proton therapy did prove itself. This treatment, in my case, it did help, but the surgery apparently was too risky, wasn't clean enough, and that was my problem. So I would pick very carefully the place that I would go to do surgery in.
Where would you have gone?
I don't know. I don't know of any other place in Israel. The Ichilov is the best place, so maybe I would go to Ichilov, but maybe I would look in other places in the world.
Okay. What would you recommend a parent who is now starting this journey of dealing with ChondroSarcoma in a young patient?
I would recommend to see as much doctor as possible and to read as much as possible, and also to hear of other cases, to ask of patients that had something like that, because the first thing that you will hear about ChondroSarcoma is only surgery, no chemo, no radiation. But the fact is that it's not true. In my case, radiation did help, and I also tried chemo. It didn't help me, but maybe it will help you, and you should go read and investigate. And there are other treatments for chondrosarcoma, not only surgeries.
Anything else?
No.
Thank you for your time and for sharing.
Thank you.
Is that?
If you have any question or information that you need, I would be happy to share. You could contact me. I have the information here on the site, and vice versa. If you have information that you could tell me, I would be happy to contact you.